Thank you all for coming to our special One Health doubleheader and our first session of the Cornell K Center for Wildlife Health Distinguished Speakers Series. I'm going to start off by just, for those of you who don't know, giving you a quick overview of the Center for Wildlife Health. And then I'm going to have our first speaker introduced. But for those of you who don't know us, the vision for the Cornell K Center for Wildlife Health really is about a healthy future for wildlife, people, and planet. And our mission is about transforming science into impact through discovery, engagement, education, and policy to ensure a healthy future for wildlife and the environment that supports all of us. And why do we do this? Because we need nature, and now nature needs us. And what do I mean by that? We need nature, we need biodiversity for all of the life-sustaining things that it provides, from clean air to clean water to nutritious foods and climate mitigation. But when I say that nature needs us, I often get pushback. People say, oh, nature will be just fine. Nature needs us to be more mindful stewards. Nature needs us to think about using natural resources in a sustainable way, not mine it, but think about it as natural capital in the bank that we live off of the interest of, so that future generations can continue to benefit. That's really important in terms of a sustainable future. All the work that we do at the center, which covers now almost 30 faculty, staff, more students, postdocs, et cetera, we sort of have four pillars that capture our work. We respond to the health threats to the survival of key species around the world. Many of us focus on policy. We provide landscape level guidance on wildlife compatible policy and practice in the land use realm. Many of us work to minimize disease transfer at that interface between wildlife, livestock, and people. I'm sure you're all familiar with the One Health paradigm. It's really an approach that recognizes those interrelationships, the fact that the health of animals, wild and domestic, and ourselves and the environment are all inextricably linked. But all those three pillars really roll up into this last pillar, which I describe as building new constituencies for wildlife conservation. What I mean by that is many of us who work in conservation, our first interface, whether it's in New York or Southern Africa or Nepal, we're often working with departments of wildlife or ministries of environment, and that's critical. But where we can really have leverage is if we can make biodiversity conservation relevant to broader constituencies, to people who are interested in agriculture, public health. So if I get to convince a minister of agriculture or a minister of public health, or ideally a minister of finance, that conservation is in their best interest, that's when we can really impact change. And so we're trying to use the One Health approach to broaden awareness about the relevance of conservation to all of these sectors. I want to now just tell you a little bit about why we thought it was important to have a distinguished speakers series. We think, we are a relatively small community in wildlife health, but I think we punch above our weight. And we wanted to share some of the best expertise in the world with the Cornell community. And I couldn't be more excited than to have the colleagues we have presenting to you today. We chose Dr. Craig Stephen and Dr. Marcela Uhart because they really represent the best of the best in terms of moving science to policy and action through that One Health lens. They are friends, colleagues, and really thought leaders for many, many years, and I'm just thrilled that we have them. So we're going to transition to our next speaker. And I think I also forgot to introduce myself. For those of you who don't know me, my name is Dr. Steve Osofsky, and I'm director of the Cornell K Center for Wildlife Health and a professor here. I've been here about 9 years, but before I was here, I was at the Wildlife Conservation Society for 14 years, where I got to know our next speaker, Dr. Marcy Uhart, who I'm going to read her bio so I don't get it wrong, but this is how I feel about Marcy as a leader in One Health, and really, again, someone who's trying to make a difference, just like what Dr. Stephen was saying. It's not just about studying problems, it's about trying to solve them. So Dr. Marcela Uhart is a wildlife veterinarian with 30 years of experience in free-ranging wildlife health research and conservation across Latin America, with a particular focus on marine mammals and seabirds. She serves as the director of the Latin America program at the Karen C. Drayer Wildlife Health Center, University of California, Davis School of Veterinary Medicine. She's based in Patagonia, Argentina, where she specializes in addressing health challenges facing free-ranging wildlife, including the impacts of infectious diseases, toxins, and human interactions. Her work is obviously grounded in a One Health approach, emphasizing the interconnectedness among the health of wildlife, people, and ecosystems. And again, it's just an honor and a pleasure to have Marcy share some real insights from her long years of research and practical experience. Marcy.
Okay, so disclaimer, I did not talk to Dr. Stephen before my talk. Spoiler alert, what you'll see is a lot of, I guess, that's not the first one. A lot of application of what Dr. Stephen said to a case study. It is not actually a surprise that we're aligned. It's actually good for me to hear before I present to you, but also it just shows as an example that, you know, One Health in action looks like what it looks like, and I'm happy to be able to take that torch. So what I'll be talking about especially is about H5N1 Avian Influenza. And what it means in terms of how far we're pushing the limits and how this is therefore becoming a very daring experiment in global health and where it might lead us. So this is now a global problem, and as such, it needs global solutions. And that is not to say that the local solutions don't have to occur so that then the global solutions actually happening. But at this moment, we have a very important threat on human health with many outbreaks throughout the world affecting humans, many of these events that we call spillovers, where humans get infected from an animal virus. And it's even becoming to the recollection of international organizations like the UN Food and Agriculture Organization. Last week, it actually released a call to action globally because they're initially being a little bit reluctant to state this very clearly. Now it's becoming clear that we have to do something about it. Not only is this disease getting into mammals and including humans, but it's also becoming a big food security and livelihoods issue. So one of the particular things about this virus, especially, or this disease, is that it is an evolving target. It evolves all the time. So it is a threat that we've known for some time, but it changes all the time. Influenza viruses have a very small genome, and I won't get too technical, but there are 8 little segments in there, and they have this amazing capacity to mix and match all the time. And the virus is excellent at doing that because that's how it copes. That's how it is resilient in its own benefit, but it might not be beneficial to us. So there's a big risk right now, especially whenever it gets into humans, that it might mix with a human influenza seasonal virus. And these human infections with especially this strain of virus that is occurring right now have been particularly increasing in recent years, especially since 2020, 2021. And that is because this new strain of this virus emerged that has a very long name, and I'll only say it once. It's 2344B. And that genotype especially is the one that is creating a lot of problems. So whenever I say H5N1 from now on, I mostly will refer to this particular strain. And with the event of this emerging new type, this is when a lot of the human infections and most of the mammalian infections actually started happening from what used to be mostly a bird disease. So the importance of this in terms of humans, for example, is that this disease can have a very, very high fatality rate. So this is, remember COVID, we were all scared, and that was a 1-2% fatality rate. So there are very many stakes, and many of them are very high. And this is because we have completely transformed, or we have actually both going on right now, both the natural transmission of the disease that involves moving animals on their own, the wildlife, the migratory birds, but also all the unnatural transmission we're bringing into this system where it's all about what we do and how we do it. But of course, because humans are involved and we don't have to rely on the natural environment, things move faster, they happen faster. There's all this spread globally that can happen. And then, of course, the virus does its own thing. So then it has this increasingly great capacity to mutate and change over time. So in a timeline you have from 2020 up here, the virus used to be a bird virus. And then as it goes on in time, in 2024 already, it was in like multiple species, especially multiple mammals. So it's kind of like we're getting to a point where, again, after COVID, we're putting our global health system into the stress test. We're giving it everything we have. We'll see if this mix is explosive enough to make something happen. And there is increasingly now, for certain, it was kind of vague for the first couple of years, but now there's a lot more talk about preparing for the next potential pandemic. And that brings me to this other point, which is, did we learn anything from COVID? I don't know. And if we didn't, how is it that we can be assumed to be ready for something next coming to us? So I'll talk a little bit about this virus in particular, a call to action globally, because they're initially being a little bit reluctant to state this very clearly. Now it's becoming clear that we have to do something about it. Not only is this disease getting into mammals and including humans, but it's also becoming a big food security and livelihoods issue. So one of the particular things about this virus, especially, or this disease, is that it is an evolving target. It evolves all the time. So it is a threat that we've known for some time, but it changes all the time. Influenza viruses have a very small genome, and I won't get too technical, but there are 8 little segments in there, and they have this amazing capacity to mix and match all the time. And the virus is excellent at doing that because that's how it copes. That's how it is resilient in its own benefit, but it might not be beneficial to us. So there's a big risk right now, especially whenever it gets into humans, that it might mix with a human influenza seasonal virus. And these human infections with especially this strain of virus that is occurring right now have been particularly increasing in recent years, especially since 2020, 2021. And that is because this new strain of this virus emerged that has a very long name, and I'll only say it once. It's 2344B. And that genotype especially is the one that is creating a lot of problems. So whenever I say H5N1 from now on, I mostly will refer to this particular strain. And with the event of this emerging new type, this is when a lot of the human infections and most of the mammalian infections actually started happening from what used to be mostly a bird disease. So the importance of this in terms of humans, for example, is that this disease can have a very, very high fatality rate. So this is, remember COVID, we were all scared, and that was a 1-2% fatality rate. So there are very many stakes, and many of them are very high. And this is because we have completely transformed, or we have actually both going on right now, both the natural transmission of the disease that involves moving animals on their own, the wildlife, the migratory birds, but also all the unnatural transmission we're bringing into this system where it's all about what we do and how we do it. But of course, because humans are involved and we don't have to rely on the natural environment, things move faster, they happen faster. There's all this spread globally that can happen. And then of course, the virus does its own thing. So then it has this increasingly great capacity to mutate and change over time. So in a timeline you have from 2020 up here, the virus used to be a bird virus. And then as it goes on in time, in 2024 already, it was in like multiple species, especially multiple mammals. So it's kind of like we're getting to a point where, again, after COVID, we're putting our global health system into the stress test. We're giving it everything we have. We'll see if this mix is explosive enough to make something happen. And there is increasingly now, for certain, it was kind of vague for the first couple of years, but now there's a lot more talk about preparing for the next potential pandemic. And that brings me to this other point, which is, did we learn anything from COVID? I don't know. And if we didn't, how is it that we can be assumed to be ready for something next coming to us? So I'll talk a little bit about this virus in particular now, and explain kind of why I'm saying this introduction, why I'm getting to the point of what everything is about very quickly. And I'll explain the history now a little bit. So influenza A viruses have this humongous host diversity. That's what they're known for, and that is natural. That's kind of what happens. They're aquatic birds that are the main reservoirs, but then they also, we can see them in domestic birds, and then occasionally we see flu viruses in marine mammals, and we see them in seabirds, and we see them in swine and horses and humans and cats, etc. And of course, what happens with these viruses, especially smart ones like this, I want to say it's smart, understand that it's just a way to say it. The way that happens with these viruses is that you could have the normal trend, which is you co-evolve with a natural host, and then you kind of adapt. You don't want to kill your host, your virus. You need them to survive. But then another mechanism you can use, and which is what this one uses, is you specialize in cross-species transmission, and this is another way that you adapt and are resilient to your own benefit. So I'm going to use an example of a virus that was very contagious, but wasn't very deadly, and that is the H5N1 pandemic influenza from 2009. And this one spread over the world very rapidly, caused about 500,000 deaths. But again, it was not very deadly. It has a low fatality rate that was below 1%. And Dr. Stephen mentioned quite a bit about this unpredictable nature of disease and pandemics and things like that. And especially flu pandemics can be completely unpredictable. So at the time of the emergence of the 2009 H5N1 virus, there were multiple avian influenza outbreaks around the world of H5s and H7s. Dr. Gilbert was involved in many of those investigations. So everybody was looking at Europe and Asia and busy with those avian influenza viruses that were out there. And then we forgot to look about other things that were happening in the world, such as living swine imported into Mexico, for example, and spreading from there to other regions. And guess where 2009 H5N1 emerged? It emerged in Mexico from a smart mix of this virus, again, from swine genes, from human genes, from bird genes, and it combined it all. It had European genes, it had North American genes, and it mixed all that in what we call reassortant viruses. And with that, it made itself into something that was extremely contagious and could spread very easily between mammals. The smartest thing it did was include genes from the H5N1 human influenza, which was very adapted to humans. The other thing I want you to note here is that if you see the dates of the origins of many of the genome segments that this virus included, it goes way back to the pandemic strain of 1918, right? The one around the Spanish flu. So these viruses don't go away easily. They persist, they stay, and they mix and match until they find a combination that helps them. So with the advent of this new virus, the 2344B strain, what is surprising is that it's even more flexible and more virulent, especially to wildlife, than it ever has been before. We haven't seen that. We know that these viruses can be deadly to humans, as I showed you, but we hadn't ever seen them actually come back at what used to be their natural reservoir species. So now we have a more complex cycle for this virus, more hosts, more diverse, and in many species actually where transmission is sustaining. So marine mammals, the cows, and other mammals, for example. So this virus was, again, very efficient in spreading globally. Until 2005, this virus emerged, H5N1 of this strain emerged in 1996 in Guangdong, China. It stayed in Asia for many years. in 2006 that went, 2005, 2006 that went into Europe, and it caused some issues there, later a little bit into Africa. But since 2020 and 21, then this new strain became this global massive spread, and it continues to spread to the point that the only place in the world that is now free of it is Oceania, especially Australia, New Zealand, and some of the Pacific Island oceans. And it even reached Antarctica, which should be the pristine continent, the one place where we don't have a big human footprint. I won't say we don't have any, but it would be the last threshold. And yet it reached there already a year ago in January of 2024, sorry. So when we think about how these viruses emerge, these what we call high pathogenicity strains, they come from a mechanism that involves the low pathogenicity strains that live with wildlife normally, and those spill over into poultry, and then that's where they have the opportunity to replicate multiple times in animals that may not be always in the best conditions. They transform into this high pathogenicity strains that then are very, very deadly to poultry, actually, but then they can also spill back into wildlife. And with the wildlife, they can move away and then spread globally to a bigger extent than what they can actually do only with the poultry. And what we have done and shown with this virus, especially as I mentioned, that emerged in 1996, is that we have failed to contain it, not only when it emerged and allowed it to get back into wildlife, but also as it continues to spread, we continue to fail to contain the virus at this interface in both directions. And this has allowed the virus, this one, especially since 96 up to even 10 years ago, up to the time that this graphic gets to 2014, to evolve a lot. You can see all the multiple strains that have happened from this, that have evolved from this single original strain that emerged in 1996. So multiply this by gazillions at this point, 10 years later, and we continue to see this, all these different substrains and strains and clades that multiply, and it's even hard to keep track of it because every week we have something new. And then the people who do systematics need to get together and give it a new name that is easy to remember because we have so many new ones popping up. And then we have other things that have happened that have been surprising recently. So for example, the ability of this virus to adapt and spread and be transmissible between mammals. So being a bird disease, usually it gets to mammals and then that's kind of where it stays, and that individual that is infected. The capacity to spread between mammals is what would make it more dangerous for humans if we get a disease that can actually be transmissible between people. So what we saw in South America, sadly, where we had never had any high pathogenicity viruses before of any subtype, H5 either, was that after the virus arrived in South America in late 2022, it did a few attempts of jumping into mammals, and that's kind of where it stayed until one actually found the mechanism. It acquired enough mutations to make it sustainable. And that new marine mammal adapted clade now infected a person, but also infected a bird. And from then on, it moved across the Pacific southwards and then up the Atlantic northwards and infected marine mammals consistently along the coast of multiple countries. So we have a mammal-adapted virus that is spreading efficiently between mammals and is also spreading across many nations. And what we're looking at now in the data that we have from the investigations of those outbreaks is that that mammal virus was capable of infecting birds, and this also happened in Argentina and Uruguay, not only in Chile in that case, but also we can see how that mammal-adapted virus transmits from bird to bird, yet sustaining all the mammal-adaptive mutations. We can see a few that are reversing now, but it's moving with birds, and it still holds on to its capacity to infect mammals very easily. And the relevance of this is that marine mammals are confined to the water and to their whatever length or distance they can actually swim. But birds are much more, right, they can spread a lot more. And with that, the disease can actually spread farther and faster, which is actually what we're seeing. So in South America, looking at the virus allowed us to look at what I just mentioned. So on the one hand, it spread from the north to the south and then back up again from south to north. But importantly, the virus did a different thing. So it made two different clades. It made an avian clade that only moved with birds, which is the orange one here. And then it made a mammal clade that only or mostly moved with mammals, yet it could spill back into birds. So this virus has increasing capacity to mix and match and adapt to whatever is thrown at it in terms of, obstacles that we think to place. And of course, moving with wildlife, it doesn't have any significant barriers. And I experienced this firsthand in terms of its deadly capacity for wildlife and why this is a conservation crisis. And I'll be talking about that specifically tomorrow morning in the symposium, is that bird flu can kill massive amounts of wildlife, and it is doing that worldwide. So beyond the risk to food security, to livelihoods, to poultry, to our industries and economies and human health, it is having an impact that we have never seen before on wildlife populations. And I witnessed these effects personally, where in witnessing the deaths of species that have never been affected by anything like this before. We lost 97%, nearly all the babies that were born to elephant seals in 2023 in Patagonia. And overall, only in South America, this virus has killed more than 500,000 birds of many species and nearly 50,000 mammals, probably a lot more. This is only what we can count. And Peruvian pelicans were one of the species affected up here. Those are endangered. They were endangered before bird flu. They lost about 36% of their population in the first wave. They skipped a year of reproduction because there was nobody left to breed, and now they're breeding again and again being hammered by high-path AI. So we have a new outbreak ongoing as of January of this year. So it's a critically endangered species now, and who knows if it will recover. And then also in places as far as Antarctica, we've lost some key species. So all of the species in the ocean are relevant, but some are the cleaners, right? We need scavengers, and skuas are the cleaners of the entire ecosystem of Antarctica. And surprisingly, or not surprisingly, or who knows, unpredictably, they are the most hit species in Antarctica, in the Antarctica ecosystems. So this is something we did not foresee. Up in our list were penguins, and those are the least affected. So again, as Dr. Stevens said, diseases behave unpredictably, and I can attest to that very closely. But what may happen in a system like Antarctica, where you have freezing temperatures nearly year-round, with a virus that remains in carcasses and won't go away because they won't thaw, they won't disappear, there will be no scavengers to clean up that. We don't know what it's gonna mean in the future. And then, of course, if we look at the other species that are being affected, we have the virus now in domestic mammals, both production animals, especially the dairy cows, being very concerning nearly everywhere in the US. I don't have to explain that to you very much. And then, of course, now also in cats. And the big difference with cats and everything else is that cats sleep with us. They sleep indoors, they live indoors. They're very close to humans, much more than dairy cows, where the exposure is still considered of high risk if it's occupational exposure, right? And the surprising thing is that these transmissions, or that these events in cats, and especially the dairy cows, happened after 2022 and 23, when we had massive spread of the virus in fur farms in Europe, both in Spain initially and then in Finland. And I say this because we don't really learn very quickly. I mean, it takes us a long time to realize that captive settings for mammals that are crowded and that we move around a lot can be susceptible to something like this. And then, of course, we waited long enough to have severe human cases now, because there's a new genotype going around in birds in the US and Canada. B3.13 was the one in the dairy cows before, and now We have the 1.1 being the one that nearly killed a teenager in Canada, and then the first reported death in Louisiana in the US. So the longer we leave this virus unchecked, the longer we let it do its thing, it's a specialist in doing it, the longer, the bigger the issues we're gonna have. So the spread helped the virus evolve into this new strain that is more deadly to humans, and then we just waited a month or two, and then now it's showing up in dairy cows as well. So this the second spillover into cows as a strain, but this one is much more of concern for humans because it seems to cause more severe disease. And then also, we already know that these viruses circulating in the people exposed to the dairy cow viruses are, these viruses are capable of airborne transmissibility to an extent, but they're much more contagious and they're much more virulent. So the longer we wait, the more perfect the storm will be. And we have to remember that environmental exposure can occur. The only human case in South America, in Chile, the first one was a girl exposed to poultry, was environmental exposure, and this person nearly died, but nobody could ever figure out how their exposure occurred. And it was most likely due to the animals that he lived very close to the ocean and near marine mammals and seabirds that were being affected. Another concern is that there's a huge bias in how we're doing surveillance and how the disease is being reported. So the map on the left is the southern part of South America, and it's only up to 2024. But I can tell you for sure that there were a lot more outbreaks than are listed here, and including in red, the ones that I investigated that are not on the maps where they should be. And that is because countries become tired of and bored of and resistant to reporting because it doesn't change things. So then they start reporting to the World Animal Health Organization, and therefore they do not show up on any maps, and they're not on the radar for risk assessments anymore. So there's a big risk now in how little the countries are reporting also within. They used to have websites where you can track, just as like you do in the US and Canada, for example, where you can track where the virus is hitting every day. That is no longer the case in any country in South America, for example. Everybody has pulled down their dashboards. And then in terms of the contributions of sequences of viruses that are critical to know what genotypes are around, if you look at the circles on this map, and this is very recent, you can see the bias, and I'll show you an example in a second. And this is important because number one, it helps us understand risk. Number two, it helps us, because of that, get ready. But number three, that is where the World Health Organization pulls the information to make vaccines. So that's where you pull the vaccine candidate viruses from. So if we don't have sequences in there of what is actually circulating, we don't have the vaccines that we need. And remember, these viruses change all the time. So we're looking into some of this data with my colleague now. And we were looking at this disparity, and it made us think about how is this actually looking at? So what does this look like in reality? So when you look at these graphs, this one is in wild birds, the next one will be in wild mammals. Here you have the estimated mortality due to high path AI on the left, and then the genomic data for those viruses on the right. And this is the proportions. I summed it up here so that it's easier to see. But for example, only in Peru, we had 79% of the mortality in wild birds, 1% of the sequences that we know of contributed. Whereas in the US and Canada, we had 13% of the mortality, but 95% of the sequences that we know of come from here. And the same for mammals. When we look at the estimated mortality and the genomic data, Argentina and Chile had 74% of the known wild mammal mortality in the world, yet contributed only 4% of the sequences, while the US and Canada had 2% of mammal mortality that we know of, but contributed 86% of the sequences. So this means if we are preparing vaccine, we are preparing it with sequences that will cover only a part of the world, because that's where we know where the viruses are right now and what viruses are circulating. So a lesson that we wanted to learn from COVID was to be more equitable in our vaccine making and distribution. I don't think it's going to happen And as I said, knowing where genotypes are and how they're evolving is very important for these same reasons. And for example, the B3.2 virus that came, it's one of the blue ones, that came to South America and caused that mass mortality actually disappeared in North America by the end of 2023. And we still have it. And so how is that going to work when we're maybe manufacturing viruses for North American strains and we're not covering the entire south of the world? And then we're not even looking at these novel reassortants. So this virus continues to change. And over the last year, it changed very dramatically in Cambodia. So this 2344B virus already combined with another virus that was circulating there of the same kind. And with that came increased fatality in humans, a lot more human cases, a lot more fatalities. And in India, the same thing happened. It combined with a different previous strain of the virus. And it created this new strain that is very effective at killing cats. And that's the genome mix right down there in that graphic. But what was interesting was that, remember, there was one isolated case of H5N1 imported into Australia. And everybody was like, oh my God, I got to Australia. Well, that virus came with a traveler from India, and it was this new cat strain. So this is how we move diseases these days. And then the other important thing is that H5NX, I'll call it, because there's N1, there's N8, there's many different ways this virus is moving right now, but it is not the only zoonotic influenza virus out there. There are many. This is a map from FAO that they keep updated, and that's all the different zoonotic flu viruses that are out there right now. And then the graph on the right shows some of these viruses, H5s, H7s, and H10s, and especially the ones that have accumulated mutations. So the green curve over there, that one goes way, that's all the viruses that have accumulated at least 3 important mammalian adaptation mutations. And it has spiked in the recent years. So we have a lot of zoonotic viruses now going around that have very important mutations in them already that make them more threatening to humans. So the international organizations, many of which in which I participate, continue to pull out these risk assessments, and they do the due diligence, and they do them again and again and again. And the outcome for the most part is, well, yeah, you know, it's still low risk of a pandemic or this becoming a global health issue. And unless, you know, it's occupational exposure, the other risk increases to middle or something, medium, I don't know what it's called. But then when you look at what the countries are actually doing, the countries that are members of these organizations or are pulling out those same reports, they're actually stocking up on vaccine. So it's like, okay, low risk, or what is the risk? And actually, Finland was the first country ever to vaccinate people for H5 vaccine virus. We never had that before. There was no human virus for H5 viruses, vaccine, sorry. So number one, there's a lot of vaccine being manufactured now for humans. There's also one being manufactured now in the US for dairy cows. I mean, it's in the, sorry, it's not manufactured, it's actually being developed. But the one for humans is being manufactured at large scale, and many of the countries in the global north are stockpiling. Again, the issue about learning to distribute vaccines and some of these things is still falling off the radar. So as Dr. Stevens said, we need to think One Health, or say that we do One Health, but we also have to act One Health. And this is a complicated graph to show something that he ended up saying, and I'll move on to this now in a second. And that is to move away. Then the way things we normally do is that we always tip the scale in terms of preparedness and response, which is what we do once the virus is in the human population, and then we have to cope with it and hopefully stop it from spreading so much. And instead of doing prevention, which is what he was calling the, you know, the upstream, what we need to do before it actually gets to that point. So what we need to find a way is that we actually tilt it the other way, and then we will be doing more health-focused intervention, something that actually gets to someplace and the risk actually lowers. So the focus on primary prevention for this is what we need to do for a change, and we have to stop the problem at its source. So we have to stop this cycle of transmission that is ongoing, that never stops. And especially we have to stop it from going in and out of the wild interface to where domestic animals and wild animals interact, so that interface. So we fail continuously at stopping that, and biosecurity is a very obvious term for anybody in the health world or the disease world or the animal care world or the healthcare world overall, and yet we fail very, very, very significantly in biocontaining this and in biosecurity practices. So stopping the virus at its source from ever reaching a new strain of high path AI, which is always happening, and that might happen, we have to stop it there. We also know that waterfowl are attracted to farms. One of the reasons is because there are not very many ponds left in our agriculturally transformed landscape. So they go to the few ponds that they find. And these are very busy satellite images. But if you focus on some of the areas where the yellow and blue dots are, that's usually where little ponds are, or actually where poultry facilities or dairy farms are. And that's the places where these ducks and these are cinnamon teal, mallards, et cetera, that had GPS trackers on them. That's where they spend most of their time. These are agricultural fields in California. So they spend a lot of their time in dairy facilities. They spend a lot of their time near poultry facilities because there's food there. So they naturally go to these, they gravitate to these locations. So we know that waterfowl are attracted to farms, and they're going to be there. But also, we continue knowing that we continue to place farms near wetlands. And in some cases, these are just things that I pulled off the internet. And I want to say that this is a dairy farm and this is a poultry farm that are for sale right now. And they both have a nice pond right next to them. So if you're a waterfowl and you wanted a nice cozy little pond to sleep on, and then you want food right next to you without going too far, that's what you would do. So we continue to do this, and we know that this has to stop, and this is a really, really, really high risk factor. And this is not only happening here, it happens worldwide. These are the map of wetlands in Argentina here, and this is the map of where we have all the poultry industry in Argentina, and it's basically the same. They overlap like almost 100%. So I don't understand the logic of that. I don't know why it is. It happens the same in Peru, for example, where they're on the coast. So I don't know why that is, but definitely something that we need to consider and think about. That would be primary prevention, number one, or number -1. And then, of course, also restore the wildlands that the wildlife needs. So if we actually give them options of where to find food and give them options of where to find refuge, where they can sleep, where they can feed, where they can breed, that's what they need. So we need to restore those places so that they're no longer trapped in these agricultural landscapes, but actually have the wild places that they can go to. And as I said, we might have to start thinking about different solutions to the ones that we're actually enacting now. So we get fancy sometimes, and we do predictable models, and sometimes we actually do something. We know where things are coming, or we can predict it, or we suspect. But we fail very, very badly at some of the easiest things. Again, this biosecurity, this biocontainment. And I personally have an issue, and Dr. Stephen mentioned it as well, is like I have an issue with us in this world, with the food insecurity that there is in most of the world, to continue to kill food animals to control a disease after we've been trying it for 30 years, and it hasn't worked, obviously. So at this point, and this is probably a rough estimate, but given by an expert, we have killed at least 612 million domestic birds to control this disease, aside from the other 47 million that have died from it directly. And yet we're still talking about the threat that H5N1 poses to all of us. And then, of course, there's a question about the H5 H5N1 vaccine, as I mentioned. But again, it's like, I know we're vets, we like our toolkit, and we like to have all the fancy technologies, and we're now thinking of our messenger RNA vaccines for H5N1. But again, we have smarter things that we could be doing, right? We could do all the other things, the nature-based solutions. We could stop it at its source, not having to vaccinate every single animal. I think that if we actually have a vaccine for H5N1, we might protect people, we might protect some domestic animals, or all of them. And what about wildlife? So again, I think if we started thinking deeper again, and we're going back to those causes of the causes of the causes that Dr. Seaman was just saying, it's like, well, yeah, we can continue business as usual. And we could continue with the food production systems that we have right now, where we have these industrial practices that keep all these animals together that actually are the perfect source for a high pathogenicity virus of any kind to emerge. Or we can actually start thinking a little bit differently. It is not going to be easy. It is not going to be overnight. I don't know what the solution is. Personally, that's not what I do. But there are people who are actually now thinking about these things, and we have to start thinking about different models of food production. So for example, there are some people working on this new thing where they're saying, well, instead of defining agricultural yield by X tons of wheat per acre or whatever, they're saying it's how many people you can nourish per hectare. Isn't that a better metric? And isn't that a different way that we could be thinking about food production system, where food production means we're going to feed people. So ultimately, our goals should be set in those places, and that is how we should measure this, to be able to have a system that is consistent with sustainability and for us to survive in the long term. Without wildlife, we won't be able to survive. Without food production systems that are sustainable, we won't be able to survive. So all in all, I think we have to be looking at transformative changes, those disruptive changes that need to really, really go down deeper into how we're producing animals and how we're getting our food these days, something that is more aligned with the planet in which we can all live. A couple of weeks ago, early March, the World Organization for Animal Health and the Food and Agriculture Organization released their global strategy for the prevention and control of high-path AI for the next decade. And this is the first time in the 30 years or 20 years of dealing with this disease that, number one, the wildlife sector has been involved in this. Well, we haven't invited first, and then we were involved in actually shaping this plan, which is for poultry. It is not for environmental management or wildlife, but we have been invited, number one, and number two, the suggestions and the concerns about welfare and about wildlife and about biodiversity and about sustainability have all been included. So you have words, and this is one of the goals of that plan. I put it here because it's like, I want to frame it and put it on my wall. We talk about multidisciplinarity. We talk about multi-sectorial collaboration, having multi-stakeholders engage, One Health collaborations, and at all scales. And this doesn't specifically mention biodiversity. That is in the text many, many times throughout this document. So this was released a couple of weeks ago, and I think it's a big breakthrough that finally these global agencies that are looking after world health, in this case, mostly for animals, but also for humans because of the risk that this disease implies, are thinking in this way and are putting out this strategies, but also with this, they're committed to defining a 10-year plan for all countries around the world that each country is going to have to prepare for itself to enact all the obligations and the theory of change that is in place in this strategy. So I invite you to look it up also online and think about it and look at it that way. And then, of course, there are some other groups that are focused on One Health interventions and how to be prepared and prevent the next pandemic. So that's a relief. Most of these things are new. They're from the last year or so, but there is some people that are starting to think of this, and hopefully mostly going on in Europe. So hopefully we can incorporate a little bit of that in other parts of the world as well. because I think we kind of need to be thinking about that. And that will be the end for me. Thank you. We should not remove the penguins from the slide. Can we leave it there? Sure.
Yeah, I'll stay up. You're going to answer.
Oh, yes, sorry.
Marcy, thank you. Just really inspiring and also intentionally, I think, terrifying that we have not learned what we should have learned. We do have time for questions. Is Sebastian here? Do I see Sebastian? Yeah, we have a rule at the Distinguished Speaker Series that I just made up. If you are a PhD student or a postdoc and one of your first author papers gets cited by the speaker, you have the option of asking the first question.
Thank you. Thank you, Dr. Hart. So my question is, could we say that HPI is considered to be endemic now, like in South America and Subantarctic Islands, or are these migratory birds, like this inflow of migratory birds, the ones that are feeding into like the disease into these populations, or is a combination of maybe both? What do you think?
Yeah, I have struggled. I struggle these days with defining high path AI H5N1 or NX. Number one, because there are N's of different kinds going around. There are all these different strains going around. So, I mean, I think it has come to stay in most of the places where it actually showed up. It's becoming endemic in those places, whether we like it or not. We see in some places, we no longer see the seasonality that we used to see. It doesn't disappear. In South America, it was apparently gone for a year, and now it's back and hammering everything again. And it is the same genotype, the one that's extinct in North America. So that's why I struggle with this. So whereas there's huge evolution in some sectors, in others, there's not so much, maybe because there are not so many local viruses to mix with of that same type. So I would say it's pretty endemic most of the world and globally speaking, but it continues to reemerge. And that is what is a little bit surprising. And every time it emerges again, it causes massive outbreaks of everything. So for wildlife especially, I don't think it's endemic at all. And it's going to continue to be a problem for many, many years until the populations build up resilience, if we have any left. I mean, some of the species are not going to do well.
Thank you.
Other questions? Yeah, yep.
You mentioned that ponds attracting the waterfowls being a high-risk factor, but ponds are in open space, is especially hard to control. So is there any potential measurements or like currently existing measurements to control that risk factor? Thank you.
Yeah. Okay. Yeah. She's asking about ponds being a risk factor because they attract waterfalls. So is there potential measures that can be done to reduce that risk factor? Did I get it okay? Yep. So I want to say two things about that. Number one, another glorifying change in the world since this virus emerged in '96 has been that when Dr. Gilbert and I were first challenged by this disease in 2005, 6, 7, everybody wanted to kill all the waterfowl. And our main struggle was for that not to happen. This time around, we're talking about sustainability and changing the poultry business to preserve wildlife and biodiversity. So that's why that is a huge gain. And I link it to your question because in the old days, maybe somebody would have said, drain the ponds, right? That's what everybody wanted to do. And they did that quite a lot in the last couple of decades. So that recommendation wouldn't happen anymore. Mostly what is done now is that if there are ponds near poultry farms or whatever, what has to happen is that those facilities need to really, really, really upscale their facilities. They have to wildlife proof them, basically, like you would do with if you had rats or mice, right? Rodents coming into your house, you would want to rodent proof your house, so that wasn't risk factor. So what needs to happen in those facilities is that In the long term, we need to think about not having poultry facilities right next to ponds, or not having the ponds there, because they will attract that, as well as, you know, any leftover food that's out there. And there's an interesting case from another thing that can be done at those ponds, is that if they're dead birds or whatever, that could be contributing to contamination of the environment and transmission of the disease, you can remove those carcasses so that there's less virus load in the environment. And that you can only do that in certain conditions. You have to be able to dispose of the carcasses and other things. And there's an interesting story about that. So in Pennsylvania, last year, there was snow geese dying at a big refuge, and the wildlife managers went there and were picking up carcasses, but also so that other birds wouldn't get, this was the wildlife managers, so that the other birds wouldn't get infected, they shot several. And when they were shooting the ones that were sick or whatever, what happened with the rest of the waterfowl that were there? They left, because they don't like shots. I don't either. So then they left, and they landed at other little ponds that were available, and that to that point had been spared. And those little ponds were near poultry facilities. And then we had some of the bigger outbreaks last year in poultry in Pennsylvania that had not happened before. And that was all our doing. Yeah.
So I can't help but think about the convergence between some of these points you've made, basically about landscape level epidemiology, and those of us who have heard Dr. Plowright's group speak about this, and the NEPA story, and the deforestation, and where the bats are coming into the horse farms. My question, Marcy, is in the four that you're involved in, because you are playing a role at the table with FAO, with WHO, and WOA. Are we getting to the point where these landscape level interventions are being taken seriously, that upstream thinking more and more? I mean, it's still frustrating from an ecological point of view that the real resilience is in restoration. And I'm hearing this from colleagues around the world, but how long is it going to be before we start to see more policy uptake on this?
How long?
Easy question.
Yeah. I mean, again, you know, being in this landscape of this particular disease for the last 20 years, I think the changes in the last 4 are amazing. I mean, again, because we're not talking about shooting all the animals, the wildlife. Now we're talking about ways that we can actually make this better for everyone and talk about sustainability. And there is talk about change, this transformational change in how we produce food and all, and it's getting inserted into these plans, but these are 10-year plans, right? So at least the future, at the very least, it's 10 years away, if not more, I would say. And I think slowly this is moving that way, but it's going to be a while. I'm optimistic because we have moved from where we were, but again, I don't see us learning quickly enough for the speed at which these things get thrown at us. Because right now, again, it's not only this zoonotic influenza, there are multiple, but then there's also Nipah, and there's also Ebola, and there's also, you know, all these other things that are happening at the same time because of the same drivers and the same environmental factors. So, yeah.
Right. For the students who find this depressing, think of it as job security. Other questions? Yes, Dr. Schott.
Not actually 10-year plan yet. We'll do that. Can you tell me if there's any mention of molecular techniques to make poultry more resilient, for example, with CRISPR-Cas13?
Yeah, I know I don't know that it's in the plan. It probably is. There is a lot of discussion about that. There are some discussions about improving all kinds of poultry production in terms of facilities, but also in terms of maybe having more resistant animals, but also different types of production. So maybe it's less intensive or whatever. Yeah, so there's some discussion about that. I'm not a big expert in the poultry realm. Yeah, but I've heard of it, yes. The same with swine, right? There's all the 2 groups that this is a big discussion because of the risk.
Any other questions? Great. Well, I couldn't be happier in terms of both Dr. Uhart and Dr. Stevens sharing with us their perspectives on One Health and really trying to make a difference. I am just overjoyed with our first ever Distinguished Speakers panel, and thank you both again for making the time and for sharing your insights with us. Let's give everyone one more round of applause. And we'll keep you posted. If you want to sign up for our newsletter, wildlife.cornell.edu, and there might even still be pizza left out there. I'm not sure.